For joining me for this presentation today. My name's Clare Murray. I'm the Director of Communications and Engagement for Health and Wellbeing Queensland. I'm here today to share the story of Wellness My Way, which is a place-based personalised program designed to improve health and wellbeing in the Maranoa region of southwest Queensland. The project demonstrates how community-led, localised strategies can drive engagement with preventative health services. This right? Yes. Before I begin, I'd like to acknowledge the traditional owners and the lands on which we meet today, the Ngunnawal and Gambari people, and also the traditional owners of the lands on which I live and work, the Yagara and Turrbal people. As with nearly all projects, the work presented today is more than just my own. I'd like to acknowledge my colleagues from Health and Wellbeing Queensland, our program delivery partners, and our research and campaign agencies. So a quick introduction to Health and Wellbeing Queensland for those of you who are unfamiliar. Our focus is to make healthy happen for all Queenslanders and reduce the impacts of chronic disease. We work closely with the Queensland health system, with government, communities and other sectors to improve the environments where people live, learn, work, play and age, helping to create a healthier Queensland. We are part of the Queensland Government, but we sit outside the Department of Health. We're a statutory agency with independence, but sit within the portfolio of the Minister for Health and Ambulance Services. So why are we working in the Maranoa community? The Maranoa region is a local area in southwest Queensland, which includes the towns of Roma, Mitchell, Surat and Injune. The southwest region, like a lot of rural communities around Australia, face significant health challenges. The high prevalence of overweight and obesity, physical inactivity, poor vegetable intake, risky use of alcohol and smoking daily is concerning. So to address the rising rates of modifiable risk factors in this region, Health and Wellbeing Queensland partnered with the South West Hospital and Health Service, Queensland Health's Health Contact Centre and the University of Queensland's Centre for Health and Wellbeing Research Innovation to develop Wellness My Way, a free program that connects individuals with personalised health services based on their risk factors. Wellness My Way addresses chronic disease issues via a single front door, an online health and wellbeing assessment, followed by coaching and referrals to free or low-cost services. This digital approach enables access regardless of location, which is critical in rural and remote regions. It's underpinned by a multi-strategy public health campaign, blending digital and traditional media through paid, earned and owned channels. What makes this campaign unique is its use of local places and faces, harnessing trusted community figures to engage the public authentically. I think the video provides the best overview for the program. See if I play this or the gentleman at the back does.
The lifestyle choices we make today can determine our future health. Our future health doesn't just impact us, but loved ones and the local community. Introducing Wellness My Way, a program focused on giving you a healthier future. Simply take the free health check, then a telephone coach together with you will develop an action plan and connect you to free and low-cost health and wellbeing programs. Age well into the future. Search Wellness My Way today.
And so all those people that we feature in that video are local community members of the Maranoa who we connected with before obviously we produced the campaign. Just checking I'm on the right slide. To raise awareness of and engagement with the online health check, it was identified that a dedicated and targeted social marketing campaign was required. The marketing campaign, just like Wellness My Way, needed to be co-designed with community and address not only the barriers and motivators to engaging with health improvement and behaviour change programs, but the consultation fatigue that the community was feeling following many, many different government programs being piloted in their community or other engagement and consultation activities. The campaign objective was to drive behaviour change, specifically to get adults aged 35 to 60 to take the online health assessment. The campaign was designed and shaped by both quantitative and qualitative insights from from local community advisory network members who represented the larger regional towns of the Maranoa, as well as some of the smaller outlying areas. We looked at barriers and motivators to accessing preventative health programs, as well as tested a number of creative territories to identify messages that would be accepted and engaged with. Using the COM-B behaviour change model, we identified and proposed capability would be to provide it free and online. The opportunity is to be local and virtual service links, and the motivation was messaging around protecting health for yourself and your family. When it comes to accessing preventative health programs, what the community told us wasn't overly surprising. The key barriers: cost, time, transport, health literacy, and access. And the motivators: family, personal health, and convenience. Taking all of these insights into consideration, 5 campaign concepts were tested with community, based on the different themes and emotional territories. Don't gamble on your health. Don't let your health affect your children. What does the future look like for you? 15 minutes could add years to your life. And look after yourself like you look after your car. Each of the creative territories tested had positive and negative feedback. Positive feedback included the messaging was a powerful driver. It was clear, simple, punchy and direct. There was a clever use of metaphors to engage the audience, and leaning into risk could be an emotional driver. Negative feedback included, well, don't take the negative slant. Don't tell us don't. Some of the messaging could inadvertently create procrastination and delays to health checks, and applying the same type of marketing from one behaviour to another could actually be confusing, and this related specifically to the don't gamble on your health messaging. When the consultation groups were asked to rank the concepts in order of perceived effectiveness, projecting the future or protecting the future, depending on who you ask, was the preferred concept. It was considered as powerful and sparked curiosity, tapping into a sense of vanity about ageing that can drive people to complete the health check. The community told us the language should project a sense of empowerment and control over your future, rather than telling them. Checking in on your health is the best health strategy you can follow. Community also told us that combining the changes in appearance with physical impact of poor health choices, such as the changes they would have to make to their lifestyle and mobility, could also be a driver for change. We could consider merging this messaging with the impact on kids messaging. It's not just the impact on the people you love, but also being able to do the things that you love within that picture of health scenario. Those aged 35 to 50, which represents 19% of the Maranoa population, connected with the Protect Your Future campaign messaging. And when we discussed examples of implementation and how we could apply this creative territory in the real life, the community suggested things like a TikTok filter, which ages you and links to the health check. A QR code for when they're taking a selfie or looking in the mirror at pubs and clubs, schools, colleges, or even the hairdresser. And activations at events like the Roma Cup, where people come for fun and emphasise the importance of improving your health choices so you can continue that fun and enjoyment into future life. The second creative territory to receive majority positive feedback was maintenance. There was immediate engagement with this idea among the consultation groups, with the messaging striking a chord with its positive and clever spin. There were suggestions from the consultation that outside of the yearly car service concept, the concept could be used when buying or leasing a car, or at the car wash with a QR code on a hanging air freshener. Community told us that this messaging may capture older men's attention, who tend to avoid the GP, by linking in with historical car clubs, men's sheds, as well as younger people and people in rural communities by partnering with farm machinery suppliers and retailers. There's also space to broaden out this concept into one of self-care and intercept at locations where people invest in themselves, such as gyms, hairdressers, beauticians, education settings, TAFEs, and hobby places like art or pottery. Those aged 50 to 59 years, which represents 13% of the Maranoa population, connected with the maintenance campaign messaging. So, to roll out a campaign and intercept residents of the Maranoa region in their everyday environments, a mixed method approach was implemented to deliver campaign messaging that connects in that intercept moment, meeting community where they are in their everyday, putting health-related messaging in places they wouldn't expect it or normally see it. Working with our partners at the South West Hospital and Health Service Healthy Communities team, we established a pool of community connectors, local people who have connections and influence in their community, people who can act as advocates or encouragers for the health check in an authentic way. We have local GPs, pharmacists, Rotary members, exercise physiologists, counsellors, and members of the local council. The Healthy Communities team and community connectors have run activations in shopping centres, at council Christmas carols, in local libraries and at health clinics. A mixed channel plan was also used to connect with consumers along with an earned media approach. And we also utilised stakeholder-owned channels such as those of Health and Wellbeing Queensland. But into the fun stuff, into the results. So for Burst 1, which ran August to December 2024, the Wellness My Way digital campaign created 680 quiz starts across key platforms. Search ads performed strongly, delivering the highest conversion rate, confirming that our keyword strategy successfully captured users actively searching for health-related content. While search delivered consistent conversions, we did see rising costs due to our niche geo-targeting. So to address this, in Burst 2, which commenced in January this year and will run until the end of June, we expanded to target more of South West Queensland, which has improved cost efficiency and reach. On meta platforms, Facebook drove 95% of all leads, highlighting its effectiveness for reaching our older audience segment. In the second month of Burst 1, we saw conversion improvements on Meta after adding new creative. However, as the campaign matured, costs rose, likely due to the limited audience pool. So to combat this with Burst 2, we included targeting an expansion and broader mix of content to identify which messages resonate most. Our Google display campaign exceeded expectations with a 3.5% conversion rate, which is well above industry benchmark of 0.5 to 1. And although cost per conversion was higher than anticipated, this was offset by the high relevance of the audience that we reached. One key learning: when we added copy directly to display banners, leads increased by 33%. So this tactic is now standard for all of our campaign creative. The first burst of paid media drove over 4,800 users to the Wellness My Way site, with a conversion rate of around 13%, well above industry average of 3 to 5%. While there are some minor discrepancies in conversion data between platforms like Meta, Google Ads and GA4 due to different attribution models, the overall trends align, giving us confidence in the data. Search ads delivered the highest number of conversions, as expected, thanks to their intent-driven nature, targeting users who are actively looking for health-related solutions. Google display ads drove the largest volume of traffic, but with lower conversion rate. This is typical, as display ads reach people earlier in their decision-making journey. A standout performer was actually our convenience ad placements, which achieved a 43.5% conversion rate. These were positioned in private, low-distraction environments, ideal for capturing attention and promoting action. We had bathroom posters, pub coasters, and we did end up with a car rear vision mirror hanger, which we distributed via local mechanics and car sales businesses. Again, meeting people where they are with a message that makes sense in that environment. Our letterbox flyers, while more limited in reach, also produced a strong conversion rate, showing that localised, tangible touchpoints continue to play a meaningful role. Our research indicated while these old school methods are increasing in success due to the novelty of receiving something in the mail, and anecdotal feedback showed this was a great way to reach community, especially as we featured local case studies of program participants. Broadly, our traditional media, like print, radio and outdoor, served to build initial awareness, while the digital ads effectively recaptured interest and drove users to the website where they could take immediate action. Based on those insights, we've continued to prioritise digital channels to continue converting interest into engagement while maintaining key awareness channels for long-term program visibility. Our paid and earned media campaign focused on the main publications in the region: the weekly Maranoa Today, weekly Queensland Country Life, and local radio stations. We achieved bonus ad delivery with the booked radio ads, which was always a nice bonus to get, and have established relationships now with both print publications so that they're not only writing stories about Wellness My Way, but other relevant health and wellbeing Queensland activities. So to lessons learned in the first 5 to 6 months of the campaign. The final campaign reflects the preferred approach identified through community consultation. We did what they suggested, and it's working. Women are engaging more than men. However, male engagement increased as we tailored the messaging towards them and rolled out the maintenance messaging and activities. For burst 2 of the campaign, we have developed new creative aligned with 4 new messaging pillars. This expanded variety of creative assets allows us to optimise more effectively and gain a deeper understanding of which messages resonate best. If this program is rolled out in other regional communities across Queensland, it's crucial to regularly refresh creative assets to maintain brand vitality and prevent creative fatigue. This ensures that our messaging remains impactful and fosters a positive brand perception. And one of the key things we learnt was that harnessing our local networks is invaluable for us to ensuring brand visibility in the environments frequented by the locals and allows us to forge deeper, more authentic connections with our audience. That just summarises the last couple of points. So where do we go next with all these insights? In January this year, Wellness My Way expanded from the Maranoa Council area to the broader Southwest Hospital and Health Services area, covering more than 320,000 square kilometres and home to over 26,000 people. The social marketing campaign is also expanded to cover the wider geographic area, and this is referred to as Burst 2, which commenced in February this year and runs through until the end of June. With in-principle support to extend the current pilot program for another 12 months, a refreshed iteration of the campaign is due in market September 2025 through to June next year. Although this time it's being delivered fully in-house, without dedicated agency support and with a much lower budget. We are currently developing a campaign strategy and channel plan to identify new content that we might need, new messaging, and a refreshed approach. But as we refine messaging, deepen community insights and expand reach, especially among under-engaged groups, our goal remains simple: empower every individual in the Maranoa and the broader Southwest Queensland to take charge of their health their way. Thank you very much for listening and look forward to any questions.